Hi, I'm Dr. Loren Mathis, and I want to welcome you to my new and improved thyroid DVD entitled The Unresolved Thyroid. Why do I still have thyroid symptoms even though my lab tests are normal? Let's fasten your seat belts. Here we go. This video is going to be about 45 to 50 minutes long. I promise you, after watching this video, you will know more than most people that treat thyroid. Really, it is, I promise you, that's how bad the situation is. That's why I really want you to get this information. It's that important for your health. So here we go. What's your purpose for being here? Anytime I do an office workshop, I always ask people, what's your purpose for being at my talk? What's your purpose for watching this DVD? A lot of people have a lot of different reasons. They have a thyroid condition. They have a loved one that has a thyroid condition. Some people have had their thyroid condition for a long period of time. Some people have just been recently diagnosed and they don't want to take a lot of medication. Whatever brings you here, I want to say welcome. You've come to the right place. This is going to be valuable, life-changing information that you're going to receive on this DVD. I promise you it's going to be worth every minute for you to watch it if you're serious about getting your thyroid condition finally resolved. Here's what you're going to learn. You're going to learn why you feel so bad despite being on thyroid hormone or thyroid medication and all your lab tests supposedly normal. I'm going to show you why you probably have not been diagnosed properly. I know that's a pretty bold statement to make, but when you have a thyroid condition, if there's anything you take away from this DVD, it's this. You might want to write this down. If you have a thyroid problem, you have at least one other problem going on in the body besides your thyroid problem. Thyroid always burns out secondary to some other problem. Also, we're going to show you lifestyle and health habits and underlying conditions that are driving your thyroid symptoms. And we're going to show you how I get to the root cause of your problem, how we discover it, how we define it, how we make a priority list and make a customized treatment plan for somebody just like you. So, if you're ready, here's the best information you're ever going to receive on thyroid. Who am I? I'm Dr. Loren Mathis, DC. I'm a doctor of chiropractic. I've been a doctor of chiropractic for the last 19 years. The whole goal of my practice is to use natural methods to help my patients regain their health and teach patients how to maintain, not only how to get healthy, but how to maintain that health. I've studied numerous seminars that are listed out here on this slide: functional blood chemistry, functional endocrinology, functional neurotransmitters, and thyroid mastery, under the tutelage of a Dr. Datis Karazian. Datis is a chiropractor also. He teaches endocrinologists in America endocrinology. That's how good he is. He's not normal. He reads studies for fun. That's just his thing. He's just constantly reading studies. And he's written a book, which I'll show you here in just a moment. I also studied under Dr. Michael Johnson. He's the author of What Do You Do When the Medications Don't Work? A non-drug treatment for dizziness, headaches, and fibromyalgia and other chronic conditions. And I also studied with a company called Apex Energetics. In my opinion, one of the best nutritional companies in the world. Why? Because they have 5 medical doctors that do nothing but research, medical studies that are out there that have been done, research that's already been done, that your and my tax dollars have paid for, that details how you handle these chronic conditions naturally with natural supplements and without medications. And I always tell people, welcome to the 1% Club. What do I mean by that? This information is so cutting edge. This is so new and valuable information that has been around for years, but very few people have acknowledged it. Why? Because the pharmaceutical industry doesn't like this information. They can't make $1 billion on it, so it's been sifted off into the archives. But this is super good information. Some of this is brand new. Some of it's been around for years. And I always say, welcome to the 1% Club. Why? Because your chances of hearing this information are relatively slim. So, welcome. You're going to get some great information off of this. And the biggest question I get, why is a chiropractor teaching on thyroid disorders? I'm going to tell you my story here in just a moment and how I got here. My wife, the love of my life, who I've been married to for 21 years, developed severe hypothyroidism and postpartum depression after the birth of our 8th child. My wife is normally a lovely, bubbly, upbeat lady. She's the wind underneath my wings that keeps me going. And when she got sick and she developed hypothyroidism and postpartum depression so bad that she wasn't getting out of bed, believe me, I was ready to find anything and everything I could to help her. Like most people, I did what you would do. You call your medical doctor. I called some of my medical colleagues, and I said, look, my wife is suffering from hypothyroidism, postpartum depression, like really, really bad, almost suicidal. We got to do something to help her. And the answers I got were subpar at best, okay? They were just like, oh, throw her on thyroid medication and put her on antidepressants. That seems to work for everybody. And I said, okay, guys, look, let's cut the crap. You and I both know that doesn't work. I want something better than that. What tests are we going to run? And all I got was, well, we really don't know, and they really don't tell you anything, and you know, it really doesn't make any difference. Just do what we're telling you. And I said, no, I'm not going to accept that, okay? This is the love of my life. This is the woman I'm committed to for the rest of my life. And when she's not good, I'm not good. So I started calling anybody and everybody I could, and I said, who are the people that really know what's going on with this? Where do I get this information? What courses do I have to take? And I found Datis. He was teaching courses with Apex Energetics, and pretty much every weekend for a long time I flew out of here, out of Wichita Falls, or drove out of here to take seminars to find out how to help my wife. This information that I learned was just eye-popping for me. I just couldn't believe this information. Some of it has been around for a long time, but neglected. Nobody's paying attention to it. Yet it's cutting-edge, good information how to treat people naturally and get them back functioning properly. That's the whole point of this, to get you back functioning correctly. That's what it's all about. Not just chasing symptoms, but finding the cause, treating the causes, and getting you back functioning properly. Well, I started applying what I was learning, and my wife made such a dramatic recovery that people said, wow, Dr. Loren, you need to do this for other people. There are so many people that need this kind of care. You really need to do this. So that's why I make DVDs like this. That's how I got into treating people for thyroid conditions and other chronic conditions. And you're going to be the benefit of all that research and knowledge. So here we go. This is Dr. Datis Karazian. He's holding the book that he wrote called Why Do I Still Have Thyroid Symptoms Even Though My Lab Tests Are Normal? It's my wife on the right-hand side, myself on the left-hand side, and that was before we started treatment. If you are a student noticing thyroid symptoms, you'll see my wife is suffering from a lot of them in that picture. What I really need to do is put in a picture of her right now just so you can see what she looks like. And you can see she's lost weight. That puffiness has gone out of her face. She doesn't have that red rash on her face anymore. She feels great, has plenty of energy, back to her old self. It's really amazing. This is the book right here. I've put it up here on a slide. Highly recommend you get this book. In my opinion, one of the best books out there right now on thyroid. Really cuts through the crap. It is all research. Every comment he makes, every statement he makes, he has a scientific study bibliographied in the back to support it. It's not just pie in the sky stuff. There's real hard research information that's out there that backs up every statement that Datis makes in this book. All right, so let's start by taking Susie Thyroid, the typical thyroid patient that comes into my office. Don't submit me in on what I'm putting out here, okay? But there's some general guidelines of the women, of the people that come see me, okay, for thyroid problem. Yes, I treat more women, but hypothyroidism does happen in men, okay? But Susie Thyroid, typical patient in today's healthcare system, or like I call it the sickness care system, is 30 to 55 years old, has 2 to 3 children, works full-time, and if she doesn't have a full-time job, she's working hard at the house, right, ladies? All right, has all the domestic duties, running the kids to volleyball and piano lessons and all that kind of stuff. She tries to eat right and exercise regularly, but despite all that, she develops some combination of these symptoms that I've listed out right here. Let's run through them just real quick, okay? Fatigue, that's probably the biggest one that brings people through my door. Low energy or fatigue. Increase in weight gain even on a low caloric diet, okay? I diet Dr. Mathis, but I can't shed a pound of weight. Morning headaches that wear off as the day progresses, depression, constipation, or alternating constipation diarrhea is a very common complaint that I hear. Overly sensitive to cold weather. These people come in my opinion, it's a nice day out there and they've got sweaters on. I had one lady wear mittens in one day in the middle of summer. It's amazing. They have an intolerance to cold. That's because of the poor circulation in their hands and feet. That's going on because of their hypothyroidism. Muscle cramps while at rest. You will find that when you're suffering from hypothyroidism, you catch the bug, the cold, the virus, the crud, whatever it is that's going around. You catch that very, very easily. and it takes you an incredible amount of time to get over it. You'll find that wounds like cuts and that kind of thing heal very, very slowly. And this is a big one right here. You require excessive amounts of sleep in order to function properly. I hear that so often. People say, Dr. Mathis, I used to be able to get by with 7, 8 hours of sleep, 6 hours of sleep. Now I got to have 10, 12, 14 hours of sleep, even to just drag myself through the next day. Chronic digestive problems, known as hypochlorhydria, where you're not producing enough hydrochloric acid. Itchy, dry skin, the hair is brittle, falls out. A lot of women tell me that they're starting to get bald on the top of their head. Edema, especially swelling in the face area that they call myxedema. And the loss of the outer 1/3 of the eyebrow. Now, you may have some of these symptoms. You probably won't have all of them. You may, I don't know, but usually people that come in have some combination of these symptoms. So, Susie Thyroid, husband says to her, you know, you're not just the woman you used to be. We need to get you some help. So, Susie Thyroid, like the typical patient, goes to see your medical doctor. Medical doctor runs the basic minimal blood analysis, which the insurance company will pay for. And on her follow-up visit, he tells her that her TSH, or thyroid stimulating hormone's a little bit off. And he's going to put her on some thyroid hormone replacement therapy, and we'll see how it goes. 8 weeks later, she sees her doctor and reports that she is no better. At which point he says, well, let's rerun the test. And he runs the test again, says her lab tests are normal. There's nothing wrong with you. It's all in your head. And then generally people end up on an antidepressant. Does that sound familiar? I hear that story all the time. Okay, or some variation of this story. It's sad, but that's what happens to the typical thyroid patient in our healthcare system today. I'll show you how we do it much better. So my question is to these doctors that tell people that there's nothing wrong with them, if there's nothing wrong with this patient, then why do they feel so bad? We're going to answer that question for you right now. Okay, let's go over some basic health statistics in the U.S., okay? There's a method to my madness, so hang in here with me, okay? 1 out of 2 people will die from heart disease. 1 out of 2 people will develop some form of cancer. 1 in 3 will develop diabetes, and 1 in 3 women are clinically depressed. 1 in 6 couples are dealing with infertility. Do you realize that is 17 million couples every year? 1 in 6 kids have a neurological condition, and that ratio is decreasing rapidly to where it's more like 1 in 5, 1 in 4 kids. 1 in 8 have an autoimmune disease, and that also is on the rise. And 1 in 8 women have a thyroid problem, and I would say that is a conservative estimate. These are all chronic conditions, folks. We have never been sicker. The World Health Organization did a study of over 100 healthcare systems, all the major industrialized nations in the world, and if you're needing crisis care, the USA ranked number 1. If you have a crisis, an acute injury, car accident, stuff like that, there's no better place to be than in the U.S. to get that problem treated correctly. So here's the bad news. In 1997, the U.S. ranked 34th in healthcare. In 2000, we ranked 37th. In 2007, we ranked 48th. And in 2009, we ranked 50th out of all major industrialized nations. Now, we spend more on healthcare than any other country in the world, and we have the worst health of any industrialized nation. We in the U.S. consume approximately 70% of all pharmaceuticals produced in the world, and yet we rank 50th in health. Now, why do I bring this out? Because if popping a pill was the solution to every problem that's out there, we should rank way high on the ranking, but yet we rank way down towards the bottom. There are countries that we would consider far beneath us in advancement, healthcare, technology, and all that are ahead of us in healthcare. Obviously, our current system is broken. That's why you're suffering. That's why you haven't been able to get the proper care that you need. What I'm going to show you now is a completely different paradigm, different way to look at your problem than just symptom chasing and popping pills like our current system is. Is your thyroid important? I get asked that all the time. It absolutely is. Look at what all it's involved in. Bone metabolism, your immune system, the brain and nervous system, your endocrine system like your adrenal glands, ovaries and testes, your gastrointestinal function, how your liver and gallbladder function, your growth and sex hormones, fat burning, insulin and glucose metabolism, controlling your blood sugar levels, healthy cholesterol levels, proper stomach acid production, and I could go on and on and on, folks. Yes, thyroid hormone's involved in just about anything you could throw at me. It's got thyroid hormone somehow directly or indirectly connected to it, so it's very important. And every cell in your body has thyroid receptors, so it's important. You bet your life it is. And just if you didn't get it, there's a crosstalk that occurs. Your thyroid talks to your immune system talks to your thyroid. Your thyroid talks to the gut talks to the thyroid talks to the brain talks to the thyroid. Your endocrine system talks to the thyroid talks to your endocrine system. One affects the other. That's why I said up at the front of this video that if you have a thyroid problem, you have at least have one more health problem going on in the body, usually more. And that's why we got to get out of this, the next shiny object syndrome that we suffer from in the United States. You know, we're always like, ooh, what's the new thing? You know, and something comes out, and or if it's on Dr. Oz, ooh, I got to get some of that. People ask me all the time, they say, Dr. Mathis, what's the one thing I could do to help my thyroid problem, to fix it? And I go, nothing. And they're stunned. They look at me and they go, you're kidding. And I go, I'm not kidding. If it was that simple, you'd have found the solution already. Most thyroid problems are a multifaceted problem. There's layer upon layer, and you have to look at the whole picture and make a priority list to get to the bottom of the problem properly. And it takes time, and it takes work to get that done. There is no magic bullet for it. Okay, now this is a very, very busy slide. I will give you that right now. But the reason I made this slide is so that you can see how thyroid hormone gets produced in the body. It starts with the brain. Brain is the master system of the body, controls everything, and that's why we do neurometabolic treatment, because we got to make sure brain's functioning properly, get the neurological side working right, also make sure the metabolic side is working correctly. So I do a thorough neurological exam on each patient that comes into my office. So thyroid hormone production starts with a part of the brain called the hypothalamus. It sends message to the pituitary gland via a hormone called TRH. The pituitary gland then secretes TSH, which is thyroid stimulating hormone, and which tells the thyroid gland, hey, we need more thyroid. Come on, let's go. So the thyroid gland then produces more thyroid hormone. Now, a very interesting point here that most people don't understand is your thyroid gland, the majority of the thyroid hormone it makes is in the inactive form, T4. And it has to be converted to the active form, T3, somewhere else in the body. Okay? So you got that? The majority of your thyroid hormone that your thyroid gland produces is inactive, not in its active form. It has to be converted. So what happens then is that this thyroid hormone hops on these little taxicabs called thyroid binding globulin. It's a protein, and it takes it throughout the body and deposits in different places for it to be converted into the active form. Now, 60% of that happens in the liver. Okay? Now, let me ask you a question. What if you had a poorly functioning liver? Would that make a difference in how you're feeling? Could that affect your thyroid metabolism? Exactly. Of course it can. Okay? If 60% is converted in the liver and the liver's not functioning correctly, you could be making all the thyroid hormone that you need, but you would still have symptoms of hypothyroidism, even though you have all the thyroid hormone that you need. That's why just nilly-willy supplementing people with thyroid hormone isn't helping them. Most have all the hormone they need. They just can't utilize what they already have. 20% of it's converted in the gut. We eat garbage in this country. Let's face it, folks. We're digging our own graves with our own teeth in this country. And we have bad gut, leaky gut syndrome. Well, when that happens and the gut isn't functioning properly and we can't convert 20% of our thyroid hormone, you think that's enough to make you feel bad? Of course it is. The other 20% is converted in other tissues in the body, okay? And it goes into the cell and it functions properly. That's how thyroid hormone is produced in your body, Okay, so obviously some areas that you want to look at are how's the liver doing? How's your gut function doing? Okay, but how many doctors that you've been to have ever checked that? I would venture a guess, virtually none. All right, there's 6 major patterns of thyroid dysfunction. Dr. Datis Karazian has identified 28. We're just going to quickly look at 6 just so that you get the idea that I'm after here, that just taking thyroid hormone isn't magically going to fix your thyroid problem. In fact, in some of these scenarios, you'll see that thyroid hormone could actually make things worse. So here we go. The first pattern of thyroid dysfunction that I want to show you is primary hypothyroidism. Thyroid gland has gotten lazy and sluggish, and the pituitary kicks out extra thyroid stimulating hormone saying, come on, we need some more thyroid hormone. How does this generally happen? Generally, I find this in young females who are professionals, very busy, high-stress jobs. They travel a lot. They're skipping meals. And when they do eat, it's generally junk or nothing filled with any kind of proper nutrients. And after a while, they start getting sluggish and suspect they have a thyroid problem. And this is one of the only patterns that may be helped by taking thyroid hormone. And I say may. Okay, I find that if we do some lifestyle change, we do some dietary change and some proper supplementation, we can get them back functioning normally and we don't even need thyroid hormone. But this is one scenario where thyroid hormone could help. The other scenario is if you have Hashimoto's, you may need some thyroid supplementation. And we'll talk about the Hashimoto's here in just a moment. So in this case, brain's working right, pituitary's working right, thyroid gland sluggish, needs a little extra kick in the butt to produce a little bit more thyroid hormone. Second one is hypothyroidism secondary to pituitary hypofunction. This means that basically your pituitary gland is burnt out. It's not working correctly. How does this happen? Well, as the slide shows, pregnancy is one of the big ones that does it. Chronic stress really does it too. People that have gone through major stresses, divorces, bankruptcies, car accidents, being laid off for a long time from their job, those kind of things really brings this on. This can also be caused, as you see on the slide here, by hormone pills, including Synthroid or bioidentical thyroid or whatever you want to call it, okay, by supplementing with thyroid hormone. This is what I was talking about earlier. You can burn out the pituitary gland by taking too much thyroid hormone, and then you actually make the problem worse. As I allude to with the picture, pregnancy fatigues the pituitary gland, and this is one of the most common causes of fatigue and postpartum depression in females after they've given birth. This, in fact, was the scenario that was going on with my own wife. Also, creams with estrogen in them. Okay, ladies, you may or may not know this, but a lot of the creams and lotions that you're using are loaded full of hormones. And that causes a spike in estrogen, usually not enough progesterone, throws that off, can fatigue the pituitary gland trying to rebalance that out. And also fluctuating insulin and glucose levels. Okay, if you have bad blood sugar, you're not able to maintain your blood sugar correctly, that can cause the pituitary gland to fatigue out too. So in this case, the brain's functioning properly, pituitary's gone weak, thyroid gland is just fine, but it's because the pituitary isn't functioning correctly that the thyroid can't function correctly. Okay? Next one is thyroid underconversion. Okay? Your thyroid gland is making enough T4, the inactive thyroid hormone that produces the most of, and there's a decrease in conversion from the inactive to the active form. Okay? Why does this happen? Again, chronic adrenal stress gives rise to increased cortisol, which suppresses the T4 to T3 conversion. Okay, your cortisol's out of whack. Also, chronic infection or chronic inflammation, as in either like an autoimmune condition, can cause this to happen also. Okay, this is often missed because low T3 is not one of the tests that normally doctors run, so that's big problem number one. And number two, low T3 does not affect your TSH level or your T4 level. So if your doctor's only running, which typically I see, just a TSH and a T4, you would completely miss this. Okay? And taking thyroid hormone in this situation will make absolutely no difference. You have to work on, if it's an infection, you got to treat that infection. If it's inflammation due to autoimmunity, you got to treat that. Or if it's due to chronic adrenal stress and you have burnt out adrenal glands, you need to address that. And then once you do, everything else goes back functioning correctly. The fourth one is thyroid overconversion and decreased TBG. You have too much active thyroid hormone, but not enough taxicabs to take it around the body, okay? What causes this? Number one cause is insulin resistance, especially in women, okay? That's why I put all the candies on this slide. What is insulin resistance? It is the step before you develop full-blown diabetes. Let me explain it to you this way. Say it was a hot day and I came up to you with a glass of water. You take that glass of water and you say, "Thank you, Dr. Mathis, that was great. I really needed that. It was very refreshing, thank you." But say I came up to you with a 3-inch fire hose and I started just dousing you with that full power of that 3-inch fire hose. You'd be, "Whoa, shut that down. Wow, what are you trying to do, kill me?" Well, that's what happens in the body when we eat too much sugar. We have made fat the number one enemy, and we've taken it out of foods, and what have we replaced it with? Sugar. Foods these days, processed foods, are just loaded full of sugar. And you've noticed that diabetes is way on the rise because we're eating too much sugar. What happens when you eat those huge amounts of carbs and huge amounts of sugar is your body has to dump out extra insulin. Eventually what happens to your insulin receptors is they get worn out. They're overstimulated and they start to fatigue out. And it takes more insulin and more insulin in order to get your insulin receptors to fire and do what they're supposed to do. That's basically what diabetes is. Insulin resistance is when they're starting to get resistant. Diabetes is when they're really resistant. It takes a lot of insulin to get them going again. Okay? And there's a way we treat that. I don't have time to go into that on this DVD. It is a topic of one of my other DVDs. But take it to the bank, that's what's going on. Okay? The cells are not listening to the insulin that's being secreted because the insulin receptors are fatigued out. This increases testosterone in females, resulting in too much free T3 and too little thyroid binding globulin. Okay? Testosterone to a female can be very toxic, especially when there's too much. Okay? And a lot of women say, "I'm noticing I'm growing facial hair where I never used to," things like that, symptoms. So in this case, brain's working correctly, pituitary's working correctly, thyroid gland producing all the hormone that you need, but because of insulin resistance here, we got too much active thyroid hormone that can't get to where it needs to go, and that's what the problem is. So in that last case, what we would do is we would then really look at treating blood sugar and getting that under control. The fifth one I want to show you is called thyroid binding globulin elevation. There's too many taxicabs, and what's happening is that the active thyroid hormone, the T3, is getting stuck in the taxicabs. Now, number one cause of this is young women taking oral contraceptives. Like I said, just nilly-willy taking hormones is not a good plan. If you get anything from this DVD, please hear me on this. Do not just nilly-willy take hormone supplements, creams, lotions, or let somebody inject hormones into your body nilly-willy. That is a bad plan, okay? So do you mean to tell me, Dr. Mathis, that you have young women in your office that have thyroid conditions? Yes. The youngest one I've seen is 16 years old that already has full-blown hypothyroidism. Why? Been taking oral contraceptive pills for a few years already. Totally messed up her hormones, totally messed up her metabolism. Okay, so please, if you get nothing else from this DVD, do not nilly-willy take thyroid supplements, lotions, creams, have that injected under your skin, all that. That is a bad plan right there. That is chasing symptoms. That is not treating the cause of the problem. So in this scenario, brain's working great, your pituitary is working great, thyroid gland producing all the thyroid hormone you could need. There's just too many taxicabs and the hormone stuck in there. And taking thyroid hormone in this condition right here will make absolutely no difference in how you feel, and in fact could make you worse. Last one is thyroid resistance. Okay, the pituitary and thyroid glands are fine, so the hormone levels. However, the hormones aren't getting to the cells. Why? Again, chronic stress. Okay, stimulates the adrenal glands to produce too much cortisol, which causes cells to be resistant to thyroid hormone. High cortisol is a problem in a lot of people that think they have a thyroid problem. In this scenario right here, the high cortisol makes the cells resistant to the thyroid hormone. This is typically what we see in men, and what makes them grow that great big beer belly, okay, that we call it. So this is a scenario we see often in men, can happen in women too, okay? But again, brain's working great, your pituitary's working great, thyroid gland producing all the thyroid hormone that you need. It's just because, again, of chronic stress your adrenal glands are producing too much cortisol, and taking thyroid hormone for this condition will make no difference in how you feel at all. All right, so let's talk now about Hashimoto's and Graves' disease. Now, everybody thinks these are thyroid problems. They are, in fact, not thyroid problems. They are autoimmune conditions, okay? Now, many of you might not understand what an autoimmune condition is, so let me quickly try to explain it for you. As the word says, auto meaning self and immune means your own immune system is attacking your own tissues. And we'll go into in just a moment why it would do that, okay? And what's happening in Hashimoto's and Graves' disease, your own immune system is attacking your thyroid gland. And especially in Hashimoto's, what you see is that you'll go hypo for a while, and then you'll sort of swing through like normal range, and then you'll be hyper, and then you go back hypo again, and go hyper again. And people are like, well, I don't know if I'm hypo or hyperthyroid. And every time I hear that, you know they're a Hashimoto's patient. And in fact, autoimmune thyroid is so common that when I start with a new thyroid case, I assume they're autoimmune until testing proves me wrong. There's an imbalance in your immune system. It needs to be addressed both metabolically and neurologically. How do we find out if this is going on with you? Proper testing is essential, and this is what is not occurring in our healthcare system today. People are just running the tests that an insurance company will pay for, and they're not running all the tests to really figure out what's going on. Why would your immune system start attacking your own tissues? Two reasons: dysregulation, or you have an active antigen. What do we mean by dysregulation? Well, you have chronic inflammation from autoimmune condition. You have an infection going on. Bad blood sugar, bad adrenals, hormone imbalances, and neurological imbalances. So again, taking a hormone cream or something like that could cause your body to go into an autoimmune condition, okay? The other one is an active antigen. Your immune system is imbalanced due to an active invader that's come into the body. Okay, so that can be a chronic infection, bacterial, viral, yeast, mold, fungus, a parasite like a protozoan or something like that. Parasite in the gut can do this also. Food sensitivities are huge, folks. We do food sensitivity testing in my office, okay, for our thyroid patients. Why? Because there are a lot of foods that drive the autoimmune response that people are experiencing. And those foods you need to be tested for it, and those foods need to be eliminated from your diet. Sometimes just for a short period of time, sometimes they need to be completely eliminated altogether if you have the genes for those food sensitivities. And if you don't address that, you can do everything else right, miss that, and it will make no difference in how you feel. How do I know? I've done it. Learn from my pain here. Environmental toxins are huge. You know, in laboratory rats, how they cause them to have an autoimmune condition so that they can study as they inject them with all kinds of toxins. Some of the stuff that's in our own foods, like mercury, okay, like mercury fillings and stuff. It is scary how many different chemicals that we take for granted can cause an autoimmune response in the body. Undigested food and putrefaction that's going on in the body. Okay, a lot of people think they have acid reflux disease. What they really have is they're not producing enough hydrochloric acid. Their food is putrefying in their stomach, and the body is trying to throw that food up to stimulate hydrochloric acid production so you can digest your food properly. There you understand what can cause an autoimmune reaction in the body. There's either dysregulation going on or there's an active antigen in the body. What are the consequences of not treating an autoimmune condition properly? Well, number one, your body develops antibodies to your own thyroid gland and starts attacking your thyroid gland. Food sensitivities, if you don't test for those, okay, for foods like gluten, casein, yeast, egg, soy, iodine, etc. This drives your autoimmune response, and if you don't take those out, you'll never get your autoimmune condition under control. Your body can develop antibodies to intrinsic factor, which leads to lowered B12, which leads to pernicious anemia. So a lot of people that are chronically anemic, and they've tried taking iron and all that for it, and it doesn't get any better, it's usually because you're not having enough B12, or you know people that have to chronically go in and get B12 shots in order to function correctly. Okay, they got this going on. Pancreas destruction and pancreatic cancer. The most favorite secondary site for autoimmune thyroid to go is to the pancreas. So a lot of these people start developing symptoms of diabetes because the autoimmune attack is attacking the pancreas, specifically the islet Langerhans cells, which produce your insulin for your body, okay? And there was an interesting study that came out at the end of 2010, which had a strong correlation that unresolved autoimmune thyroid is what's leading to pancreatic cancer. And pancreatic cancer, as you may or may not know, is hugely on the rise. It has a very low survivability rate. It's only about 7%, and it's on the rise right now, folks. A lot more of that being diagnosed, a lot more of that showing up. Why? Because we have autoimmune thyroid that is not being diagnosed and treated correctly. All right? It can also get a destruction of the myelin sheath. That's the fatty coating around the nerves. This can lead to like peripheral neuropathy. We have numbness, tingling in the feet. Okay? Diabetics develop that, and where they had no sensation in their feet anymore, gangrene, all that comes afterwards. Not a pretty sight, not a pretty condition. Cerebellum destruction, balance disorders, vertigo, dizziness happen with that, and destruction of the brain. You see people have lost memory, prone to weird infections of the brain. I mean, we've all seen people, and you see them 2 years later, and you go, wow, they've really deteriorated. What's going on there? Well, often it's an undiagnosed and improperly treated autoimmune reaction going on in that person's body, and they've had major brain deterioration going on. This is what you do not want to see happen to you. The treatment for Hashimoto's and Graves' disease is, number one, we got to remove what's driving that autoimmune response, the antigen or the dysregulation that's causing that. We got to calm down that huge inflammatory response that's going on in the body. When you're autoimmune, there's a huge inflammatory response that's going on. That's why these people look so puffy and inflamed all the time. You got to modulate and balance the immune system. We use metabolic compounds by Apex Energetics to do that, and there's dietary and lifestyle changes that need to happen with that. And how do we figure this out? Again, proper testing is crucial. It is just absolutely essential. Either you test and you know what's causing it, or you're guessing. And what's happening in our healthcare system today is there's too much guessing and not enough testing. And it just drives me nuts, because there's people that, like you, that are suffering needlessly because the proper tests aren't being run and aren't being interpreted properly, and a proper treatment plan isn't being formulated for you. What makes my office different than any other office you've ever been to before? I treat patients both neurologically and metabolically to get them better and functioning properly again. We got to have a healthy functioning brain, and we got to have the body metabolically functioning correctly. When we restore that balance, good health follows. Okay, so the typically ordered thyroid test is TSH, just one test. And that just drives me batty, because how can you manage a thyroid problem? How can you manage a thyroid condition without having all the information? I always tell people it's like this. Say your car stalled out on the side of the road, and you called out a mechanic. And the mechanic comes out and he goes, turn your lights on and off. Yep. Do your right and left blinker, and you do that. And he said, hit the horn. Beep. There's nothing wrong with your car. See ya, I'm going to leave. Now, would you be happy with that? Well, of course you wouldn't be. That's ridiculous. You're probably laughing and say, well, that's stupid. Everybody knows that. But yet, folks, that is exactly how we're treating thyroid conditions in this country. We run one lousy test and think we can diagnose the whole problem. You can't. And that's basically what's happening here. We're using a 50-year-old model to treat a thyroid condition, and we're not running the right tests. That's why there are so many people who are needlessly suffering with this. And that's what I don't want to see happen to you. That's why I've made this DVD. Here are all the proper thyroid tests that somebody should run if they're really serious about fixing your thyroid problem. And I've listed them out here for you. You can read them right there off the screen yourself. And these are the tests that need to be done and interpreted properly in order to get to the bottom, to get to the cause of your thyroid problem. If you don't run all these tests, you're just guessing and shooting in the dark, folks. And if you aim at nothing, you'll hit it every time. All right. Thyroid dysfunction is a sign of metabolic dysfunction. Proper testing, again, is crucial. Here's the tests that we run. Number one, a complete metabolic profile. That includes thyroid panels, lipid panels, liver panels, vitamin D levels, anemia, liver function. All these things need to be checked out properly. We also need to run the proper immune panels to see what are your immune antibodies towards TPO and TSH in your body, okay? To see if you've got an autoimmune attack going on. The other one, huge, is an adrenal stress index, a 24-hour cortisol level, and a sex hormone level, and your adrenal stress markers. Next is food sensitivity testing. I've kind of gone over this before, but testing for gluten, casein, yeast, soy, egg, and many other cross-reactive foods to know how we need to modify your diet to help you to heal properly and get back to functioning better. Also, stool microbial analysis to see if there's some underlying parasitic or chronic infection going on in your body. Bacterial, viral, yeast, mold, fungus, a protozoan or something like that going on. These are the crucial tests that need to be run, in my humble opinion, in every thyroid patient. And this is what is not happening in our healthcare system today. Why? Because insurance companies don't like to pay for a lot of these tests. So yes, there's an investment in tests, but the information we get is just huge in being able to properly determine the cause of your problem and uniquely create a treatment plan to help you to get feeling better. Have you been told that your lab tests are normal? If so, you're not alone. Typical lab ranges are inaccurate. Do you understand how a lab gets their normal values? They take everybody that came into the lab, they average it, and that's how they get their normal lab values. Now, I think you and I could both agree that more sick people than healthy people go to a lab. One of the basic problems that we have then is that we're comparing sick people to sick people instead of saying, hey, wow, you know, if somebody was healthy and normal, what would their lab tests look like? And anything outside of that is a subclinical presentation starting to develop the problem. And in fact, that's what happened here about 10 or 15 years ago. The Endocrinologist Society of America got together, said, you know how we're evaluating lab tests is stupid. We really need to develop more of a functional range. If somebody's healthy and functioning properly, what would their lab tests look like? And anything outside of that is somebody starting to develop a pathology before they have the full-blown disease. And those are the values we use. This slide right here, the point of showing you this is to show that most people fall into these green areas right here. They're not so sick that they're all the way out there, but yet they're not in the normal, healthy, functioning range. And that's where I find most patients are. This is why you're sick, but yet your lab tests come back quote-unquote normal if you're using the normal lab ranges. Let me show you an example of what I'm talking about. This is a patient that came into my office. She had been to 11 previous medical doctors. Every one of them told her that her lab tests were normal. And if you look at her lab test result and the traditional high-low range, you'll see that they are absolutely within range of the traditional lab high-low values. However, when you compare her test results to the functional ranges, okay, a completely different picture emerges. Her blood glucose was 73, so she's hypoglycemic because she's low. She's not in the 85 to 100 range. So this patient who was told she's normal is hypoglycemic. Her TSH, her thyroid stimulating hormone, was 4.2. It's not in the range of 1.8 to 3.0, so she's hypothyroid. Her cholesterol was 148, which is low. It's not between 150 and 200. Now, a bunch of you might be saying, well, that's not bad. High cholesterol is bad, but I guess low is okay. No, it's not, okay? You need normal cholesterol levels. High is bad and low is bad. Why? Because when your cholesterol is low, you cannot synthesize your hormones correctly. So she had a hormone synthesis problem. Her triglycerides were high, okay? They weren't between 75 and 100. They were 149. That's an indicator of inflammation and insulin resistance. And the inflammation is a marker for autoimmunity, by the way. And hemoglobin was 13, which isn't between 13.5 and 14.5, so she was slightly anemic. So this patient who'd been to 11 previous doctors, just by looking at the labs she brought me, I could tell her already that she was hypoglycemic, that she was hypothyroid, she had a hormone synthesis problem, she had a blood sugar regulation issue going on, she had markers for inflammation, autoimmunity, and she was anemic. Do you think that's enough to make her feel horrible? Absolutely. We did further testing to find out why this was going on with her, and within 6 months, she was feeling great, leading an active, normal, healthy lifestyle. This is what I'd like to do for you. All cases are a combination of neurological and metabolic, okay? You can't do one without the other is the basic point I'm trying to get across there. All chronic conditions have some things in common, okay? You can see the conditions I've listed out here, like thyroid conditions, insulin resistance, which is also known as metabolic syndrome, fibromyalgia, vertigo and dizziness, sciatica, chronic fatigue syndrome, peripheral neuropathy, rheumatoid arthritis, chronic neck and back pain, spinal stenosis, irritable bowel syndrome, Crohn's disease, celiac disease, ulcerative colitis, it's all the same thing, insomnia, Polycystic ovarian syndrome, which is the #1 cause for infertility in America right now. Miscarriages, migraine, chronic headaches, ADD, ADHD, autistic spectrum disorders, Asperger's disease, dyslexia. You mean, Dr. Mathis, you treat children? Yes. Often these kids with learning disabilities and disorders, all the way down to full-blown autism. They have a major brain imbalance. They have food sensitivities and a huge autoimmune attack going on. You calm that down properly, you get them functioning better. You can almost not tell that they have any issues at all. It is really exciting to work with kids. Now, all these chronic conditions have something in common, and it is that there is an oxygen deficit, there's neurological misfirings, there's metabolic imbalances like blood sugar imbalance, like insulin resistance, dysglycemia. There are cortisol imbalances, adrenal stress and fatigue, hormone imbalances, anemia, autoimmune attacks that aren't being treated properly, immune imbalances, food sensitivities, parasitic and chronic infections going on in the body, gut, GI, and digestive problems, and brain imbalances. Any good doctor needs to check all those issues right there in order to really help you with your chronic condition that you've got going on. Our neurometabolic health solutions, what are we doing? It's based on our lab findings and proper nutritional products dispensed to support the biomechanical pathways for healing. We look at gut and digestion, the thyroid and the adrenals, liver and gallbladder, anemias, blood sugar regulation, autoimmune regulation, hormone production regulation, just to name a few. We look at the whole picture. We do a comprehensive neurological and metabolic workup on each patient. Like I said, brain has to be functioning properly, and metabolically you need to be functioning properly. So we got to test both and treat both. Symptoms that result from a brain that's not functioning correctly, it's lost a decrease of its frequency of firing or its electrical vitality. The symptoms include chronic pain, chronic fatigue, migraine headaches and light sensitivity, blurred vision, increased sweating, difficulty falling or staying asleep, heart palpitations or an increased heart rate like tachycardia, irritable bowel syndrome, Crohn's disease, ulcerative colitis, urinary tract infections, high blood pressure, febrile fog or flu-like symptoms, also episodes of depression and anxiety, difficulty adding or subtracting numbers, difficulty scanning pages while reading, difficulty expressing what you want to say. These people say, I've got the words, but I just can't get them out, Dr. Mathis. They have difficulty understanding what others say. They're like, I heard it, but I just can't process it properly. Loss of short-term or long-term memory, loss of sensation like numbness and tingling. Changes in handwriting is huge. A lot of people tell me that, actually, interestingly enough. They say, you know, I've noticed my handwriting's changed over the last 2-3 years. They're more irritable and angry. They have problems with balance, tripping, dropping things. They drop a coffee cup all the time. And again, learning disabilities like dyslexia, ADD, ADHD, all the way down to full-blown autistic spectrum disorder. Now, some of you are going, you know, some of those symptoms sound a lot like other things. That's exactly my point. Unless you do the proper testing, neurological and metabolic, you'll never determine, if you're just using symptoms to treat somebody, you'll never determine exactly what's going on with them. All right, neurological treatment consists of treating the cerebellum and the brain dysfunction. Your brain needs two things to function properly. It needs fuel and it needs activation. Fuel in the form of oxygen, and that's why I won't accept smokers for treatment. You have to be smoke-free for at least 3 months before I'll treat you. If you're not smoke-free, it's basically a waste of time. And fuel, okay, good food, okay, going into the body. And 3, the second one is activation. Proper activation, proper stimulation to the brain to get it strengthened up and functioning properly again. So, what we're doing with neurometabolic health solutions, functional, neurologic, and metabolic solutions, is we're identifying our problem pieces like blood sugar, hormones, midbrain that's not functioning right, oxygen deficit, a cerebellum that's weak, high cortisol levels, and we bring those pieces together, we treat the whole person, and when we bring all these pieces together, we care for the whole person, and that's why I get the high success rate that I do. And like I said, it's a multifaceted problem. It needs a multifaceted approach to fix it properly. What's next? Well, I'll only accept about 7 new thyroid patients a month. Why? Because when I take your case on, you get me 110%. It takes a lot of effort and energy to work up a new thyroid case. And as you can see, I'm pretty intense. I am really, really detail oriented, because I don't just have a thyroid solution can plan thing that everybody gets. Everybody's treatment plan is unique to them based on the testing that we do. Neurological testing and metabolic testing that I outlined earlier. Today I'm offering the first 2 visits for only $47. Normally I charge $250 for that, but for watching this DVD, you can get it at the special price. Here's what happens on these first 2 visits. Visit 1, we do a complete neurological evaluation. People tell me all the time, this is the most detailed neurological exam anyone has ever done to me, Dr. Mathis. We review your existing labs if you have them, so you bring them in. Okay. We review your case history. When we decide to work together, I send you a packet. It's a thick packet. There's about 13 or 14 pages in there. It will take you the better part of 2 to 3 hours to fill that out. We review that on our first visit together, okay? And we answer all your questions, and I like for your spouse or your significant other to be there with us, okay? Now, if you don't live in Wichita Falls, hang on, I'll explain how we do this long distance. Second visit, we do a case review, and if I decide to accept your case, I will detail further testing that needs to be done, what your neurological testing showed and what it means and the significance of that. I'll go over your unique specific treatment plan that I formulated just for you. I'll review how we make this affordable for anybody who's serious, and we'll answer all your questions, and again, like for your spouse to be with you when we do that. Okay, why? It just saves explaining the same information twice for me. Okay? How do you move forward with your health? Number 1, you have to make the decision to change. You have to get to that point where you realize that what you've been doing has got you to where you are, and you have to do something different if you're ever going to move in a different direction. You have to want to change, okay? And number 2 is your why big enough, okay? Why do you want to change? From my perspective and for my practice and for what I do, my wife got ill. She wasn't functioning correctly. I wanted to help her. My why was huge, folks. Is your why big enough? Do you really want to function better? Do you really want to live an active and healthy life? Do you want to be able to play with the grandkids again? Do you want to be able to enjoy just taking a walk, being able to exercise, or enjoy some leisure activity that you haven't been able to do because you have hypothyroidism? Your why has to be big enough, okay? And you got to be willing to make those changes. That's huge. I mean, this is the best information in the world, folks, but it will not help you one iota if you're not willing to make the changes. You have to be willing to understand that, hey, there's some things that I'm doing, some bad health habits that I have to change. And when you're willing to make those changes, that's when you're going to see the exciting results. You need to, number 4, take action. Nothing happens until you move, okay? Sitting there is not going to get you better. Watching this DVD is not going to get you better unless you take action on this information that I've shared with you right now. And you got to be willing to invest in your long-term health. Okay, let's face it, insurance companies don't cover very much these days. Obamacare is going to cover a whole lot less unless we get that repealed. I mean, that's going to be reality. There's nobody that cares as much about your health as you. Your government doesn't care. Your company doesn't care. You know what I'm saying? Your health is not your employer's responsibility. It's not your country's responsibility. It's not your family's responsibility. It's not even your spouse's responsibility. You have to take responsibility for your own health. You have to be willing to invest in your long-term health. Don't look at it as an expense. Look at it as an investment. Because if you don't cherish your health, if you don't take your health seriously, you lose it. It is extremely difficult to get back. And distance is not a barrier, okay? I treat patients all over the country. We do that by telephone or Skype or something like that. We do telephone consultations. Often these people fly into Wichita Falls and see me for their first visit face-to-face, which I really prefer. And then after that, we just treat long distance via phone consults or texting, Skyping, doing something like that. But we do it long distance that way, and we get patients better. I can order the lab tests that we do. In your area, there's a draw center, I'm sure, within at least 30 miles of where you live, unless you live somewhere way, way, way remote. Haven't really found that to be an issue yet. I've got patients in Canada. I even recently got some requests from the United Kingdom, Australia, and Saudi Arabia, if you can believe it. Why? Because people are looking for this information. They know what they're being offered isn't working, and they really, truly want to try something different, a totally different approach to their problem. And the most important thing, number 7, is you have to be totally committed. There's nothing that discourages me more than people that are not fully committed. to making the changes. This is great information, again, but you got to take action on it, and you got to be committed to changing, because it's going to take some time. It's not going to happen overnight, but if you're willing to commit, I mean, the rewards are huge, folks. I mean, you just can't believe the lives that we change every single day. It is exciting work for me. Like to do the same for you. Okay, and we do all the above. Like I said, you're going to see these life-changing differences in you or your loved one's life. So it boils down to this question: what kind of body do you want to live in for the rest of your life? You want to be sick and disabled, or you want to be active and healthy? The choice you make right now will determine where you're going to end up 2, 3, 5, 6, 7, 8, 10 years down the road from now. The choice is yours to make. I can offer you it, but you got to take action on it, and you got to be committed on it. I'm Dr. Loren Mathis. I want to thank you for watching this DVD, and look forward to seeing you and helping you attain the best in health.